All right.
Okay. So basically, again, I am talking about the low vision optometrist or ophthalmologist role in low vision rehabilitation and tell you a little bit about what the doctor does in the Lions Low Vision Center. So when the patient comes in, a big part about what we're concerned with is knowing about their functional deficits. So like our testimonial this morning, she was saying a big difference between what we do and the other doctors that specialize in the health of her eyes. We're really concerned about her functional problems. Are you having trouble reading? Are you having trouble seeing? Can you see the television? How about trouble driving? When you're walking around, difficulty with steps and curbs. How many falls have you had? Do you think they were vision related? Are you having trouble with writing? What is your living situation? Are you by yourself? Are you living with family members? Are you in charge of household responsibilities? Were those responsibilities the one that you did before? So all of these things, it's pretty different from what your doctor normally asks you, because we want to know, how is your vision causing these deficits, or what is your vision doing to prevent you from doing the things that you want to do? So you guys are going to get a good look at all the different stations that we have to offer, but this is one of the starting points of the examination. So we start basically with a very long case history, talking to the patients about their difficulties, and then we take it from there. One of the important things, I think, is that when a patient comes into the room, I ask them first, who referred you here, and did they tell you anything about the exam? So the reason why that's important is because people come in, sometimes they get referred all over the place and they don't know why they're there. So I introduce the service right off the bat, and I say, you're being followed by an excellent retina specialist or glaucoma specialist. They're focused on the health of your eyes. So they're the ones that make the call about the medications, the treatments, the surgeries, procedures, anything like that to fix your vision. But what I do over here is pretty different. I focus on your functional vision. So we work with what the patient has, and we optimize that as much as possible. That's our goal, is to rehabilitate and optimize vision and function as much as possible. So this chart right here, of course, when you go see the eye doctor, they're going to ask, go ahead and read the smallest line, smallest row of letters. This chart is pretty different because it can actually, we turn this on and it enhances the contrast. This is the best possible potential vision that they have, because the contrast, meaning black and white, is really, really good. Also, there's a standard five letters on each row, and that's different because if you've ever been to the doctor, they might have a big E across the room, and the patients, you can have them come sit down, you flick on the screen and they say that's an E. They don't even have to look at it, and there's only one letter up there. This one is, so this one right here, we have this across the room, that would be equivalent to the big E. So they actually have to read all of those letters for us to know that they're 2200, 2400 to get an idea of their vision. One of the other big differences about what we do compared to other normal optometrists and ophthalmologists, so you've probably seen this contraption over here. This is how you measure for glasses. So they say, which is better, 1 or 2? We're spinning these dials here. But one of the things you might notice, and with vision impairment, it really affects people in different ways. You can have your central vision affected or your side or peripheral vision affected. Now, if you're looking through these little holes and you're missing your central vision, and you try to kind of move your head around to try to get a good piece of tissue or kind of move that missing spot out of the way, it's pretty hard to move around behind here. So we use this, it's called a trial frame. So this actually, we put these on the patients, so it goes on just like this. They wear it like a regular pair of glasses, but we switch those lenses in and out. We can make bigger jumps. So one of the most frustrating things for patients, especially if they have reduced vision, they say, I can't tell a difference. Which is better, number 1 or number 2? It all looks the same. How about this one, number 1 or number 2? That all looks the same. It's very, very frustrating. So in terms of the lenses, so we can make really, really big jumps. So I'll just pull out a couple of lenses here. So these, you can put them in front of the patient. You say, which one is better? You hold up these 3 lenses, number 1 in front of their eye or number 2. I'm going to let you guys take a look at these, and you can just see the difference. If you're looking through those lenses, there's something different in terms of the power, but that way they say, oh, number 1 was better, and then we kind of bracket from there. It's going to look a little bit different between the two. And we can pass this one around also. So it's a nice way to let somebody adopt a normal head posture, or, you know, if somebody has some sort of physical ailment, we can take that trial frame out with us to a home visit or something like that.
We are ready whenever you are.
All right. So,
And again, what's your name?
I'm Dr. Chan, Tiffany Chan.
Okay.
Folks, you're going to come out this way
Thank you.
to Dr.